Feel like something is stuck down there, low in the rectum, right at the exit. The urge is there, the pressure is there, but nothing comes out, or only a little comes out, and the feeling of fullness just won't go away. If that sounds familiar, I want you to take a breath, because what I'm about to share will probably contradict almost everything you've been told about constipation, fiber, and laxatives. And by the end of this video, you'll understand exactly what's happening inside your body, what to stop doing right now, and what actually works. Here's the truth nobody talks about. After the age of 50, the rectum changes. The muscles around it change. The nerves get a little slower, the signals get a little quieter, and for millions of older adults, stool starts to collect in the lower rectum and just sit there. Doctors have a name for it. They call it fecal impaction, or in milder cases, incomplete evacuation. But the name isn't what matters. What matters is that most people try to solve it with the wrong tools. They eat more fiber, they drink more laxatives, they push harder, they strain longer. And the problem only gets worse, sometimes dangerously worse. So today, I want to walk you through this calmly, like a friend who happens to know the medical side of it. No embarrassment, no shame, just real information you can actually use. The first thing I want you to understand is this. Stool getting stuck in the rectum is not the same as regular constipation. Regular constipation usually means stool is slow moving through your colon, high up. You feel bloated, gassy, maybe a little uncomfortable, and you just don't go as often as you should. But when stool is stuck in the rectum, the journey is almost finished. The stool has already traveled the long road. It made it all the way down to the final chamber right above the anus. And then it stopped. It dried out. It hardened. And now it's sitting there like a cork. This is a completely different problem. And here's why that matters. If you treat it like regular constipation, if you just keep eating more fiber and drinking more water, you can actually make it worse. Because adding more soft stool behind a hard stuck plug is like piling cars behind an accident on the highway. The traffic builds, the pressure builds, but nothing moves. And that's the first place people get misled. Let me explain what's really going on. In plain words, your rectum is basically a small storage room at the end of your digestive tract. When stool arrives there, stretch receptors in the wall send a signal to your brain that says, time to go. Then the muscles around your anus, your pelvic floor muscles, and your anal sphincters coordinate to relax and let everything out. But after 50, three things often start to break down. First, the rectum becomes less sensitive. Stool can sit there for a long time without you even realizing it's full. The urge signal weakens. Second, the pelvic floor muscles get tighter or more uncoordinated. Instead of relaxing when you try to go, they sometimes clench. Doctors call this dyssynergic defecation, and it's far more common in older adults than most people realize. Third, the longer stool sits in the rectum, the more water gets reabsorbed out of it, so it becomes harder, drier, more compacted, like a sponge that's been sitting on the counter overnight. Put those three things together, and you have the perfect setup for stool that just won't budge. And here's the part most people miss. This isn't really a fiber problem, it's a mechanical and muscular problem, which is exactly why fiber alone often doesn't fix it. Now let's talk about what people do at home when they feel stuck, because some of these habits are doing real harm and nobody warned them. The first mistake is straining, pushing hard, holding your breath, gripping the sides of the toilet. I understand why people do it. It feels like the obvious solution. But straining repeatedly can cause hemorrhoids, anal fissures, and in older adults, it can even raise blood pressure to dangerous levels. There are documented cases of people having heart events while straining on the toilet. This is not a small thing. The second mistake is reaching for stimulant laxatives over and over, the kind that make your colon squeeze harder. They might give you some relief once, but if the stool is physically stuck at the bottom, all you're doing is whipping a colon that has nowhere to send its contents. Long-term use can actually weaken the colon's natural rhythm. The third mistake is loading up on fiber supplements when you're already impacted. If the exit is blocked, adding more bulk behind it is like pouring more water into a clogged sink. You need to clear the clog first. Then fiber becomes helpful again. And the fourth mistake, the one I want you to remember most, is ignoring it for days, hoping it will just pass. Stool that sits too long in the rectum can become so hard it physically cannot come out without help. And in some cases, liquid stool from higher up starts to leak around it, which people mistake for diarrhea. They take anti-diarrhea medicine, which makes everything worse. This is a trap a lot of older adults fall into. All right, now that you know what not to do, let's talk about what actually works. And I want you to pay close attention here, because these are the things most people are never properly taught. The first thing is positioning. The modern toilet is not designed well for human anatomy. When you sit at a 90-degree angle, a muscle called the puborectalis stays partially kinked, which narrows the path the stool has to travel. But when you elevate your feet about 6 to 8 inches using a small stool or footrest, your knees come up above your hips, and that muscle relaxes. The path straightens. It's a small adjustment that can make a surprisingly large difference, especially for older adults. The second thing is breathing instead of straining. Instead of holding your breath and pushing, try this. Take a deep breath in, let your belly expand outward, and then exhale slowly through pursed lips, while gently bearing down with your abdomen. Not your face, not your chest. Think of it as a slow, controlled push from the inside, not a desperate squeeze. This works with your pelvic floor instead of against it. The third thing is hydration timed correctly. A warm glass of water first thing in the morning, before anything else, triggers a natural reflex called the gastrocolic reflex. Your colon wakes up and starts moving. Many older adults skip this because they wake up and immediately have coffee or medication. A simple glass of warm water, 15 to 20 minutes before anything else, can retrain your morning rhythm. The fourth thing is the type of fiber you choose. Not all fiber is the same. Insoluble fiber, the rough kind like wheat bran, can actually make impaction worse because it's scratchy and bulky. Soluble fiber, found in things like oats, chia seeds, ground flaxseed, psyllium husk, and cooked apples or pears, pulls water into the stool and keeps it soft and slick. For someone over 50 with rectal issues, soluble fiber is usually the gentler, smarter choice. But again, only after the immediate blockage is cleared. The fifth thing, and this is one most doctors won't bring up unless you ask, is the role of magnesium. Magnesium, particularly magnesium citrate or magnesium oxide, draws water into the bowel and softens stool naturally. Many older adults are quietly low in magnesium anyway. Used carefully, and with your doctor's awareness of your kidney function and other medications, it can be one of the most useful tools for someone dealing with chronic stuck stool. This is not medical advice for your specific case. Please talk to your doctor, but it's worth a conversation. And finally, there is a category of treatment most people don't know exists at all. Pelvic floor physical therapy. Yes, that's a real thing. There are specially trained therapists who can teach your pelvic muscles how to coordinate again. For people whose problem is muscle-based, not stool-based, this can be life-changing. It's quiet, it's dignified, and it's covered by many insurance plans. Almost nobody hears about it because almost nobody talks about it. Now, what if you're watching this and the stool is stuck right now? Let me walk you through what's generally considered safe. A glycerin suppository, available over the counter, can soften the lower stool and stimulate a bowel movement within 30 to 60 minutes. It's gentle. It works locally. It doesn't tear up your whole system. A warm sitz bath, sitting in a few inches of warm water for 10 to 15 minutes, can relax the anal sphincter and reduce muscle spasm. This often helps stool pass more easily afterward. A small saline or mineral oil enema is another option that many doctors recommend for occasional use. It softens and lubricates the impacted area directly. But here is the line you must not cross. Do not try to manually remove stool yourself. Do not insert sharp objects. Do not use enemas repeatedly without medical guidance. Do not use any product not designed for rectal use. People injure themselves doing this every year, and the rectum is fragile tissue. I want to be direct with you about this because it matters. Call your doctor or go to urgent care if any of these are happening. If you've gone several days with no bowel movement at all and you're now in real pain, if you have a swollen, hard belly, if you're vomiting, especially if the vomit smells unusual, if you see blood, bright red or dark and tarry, if you have a fever along with the constipation, if you're feeling lightheaded or your heart is racing, if you have liquid stool leaking around what feels like a blockage, or if you've simply tried the gentle steps for 2 or 3 days and nothing is moving, these can be signs of complete impaction, bowel obstruction, or something more serious. None of these are things to tough out at home, and there is absolutely no embarrassment in asking for help. Doctors deal with this every single day, especially in patients over 50. You will not be the most unusual case they've seen this week, not even close. Here's what I want you to take away from all of this. Stool getting stuck in the rectum is not a moral failing. It's not a hygiene problem. It's not something to be ashamed of. It's a mechanical issue that happens to aging bodies, and it deserves the same calm, informed attention you'd give to a sore knee or a stiff shoulder. The myth is that more fiber and more laxatives fix everything. The truth is that your rectum is a coordinated system of muscles, nerves, and tissues. And when that system slows down, you need a smarter approach, not a louder one. Eat your soluble fiber, drink your water, elevate your feet, breathe instead of strain. Move your body daily, even a short walk, because the colon responds to motion. And when something feels wrong, talk to a real human in a white coat, not the internet, not your neighbor, not the loudest commercial on television. Your body, even at 60, 70, 80, it still wants to work. It just needs you to work with it instead of against it. If this video helped clear up something you've been quietly worried about, do me a small favor. Share it with one person you care about, a spouse, a sibling, a friend, because there is someone in your life right now suffering with this and not saying a word. You could be the reason they finally get help. And if you'd like more honest, no-nonsense health information made specifically for adults over 50, go ahead and subscribe. We talk about the things other channels skip over, the way a trusted friend would. Take care of yourself. And remember, your dignity is never in question here, only your well-being. I'll see you in the next one.